Hi, this is Christy Kirkland, and I am doing my theory of health disparities on the health behavior model. I think this is the one that most people are linked with, even after watching the discussion lecture, that it can be proven that it's not. But the reason I think this is because not all people have the racial genetic model or the psychosocial stress model, because they don't fall into the minority groups. And those groups, I think, would be used for those more so than the ones that are not minorities. I do think the health behavior model fits more because it is people's lifestyles that can be linked to diseases, their preventive care, if they actually go and see doctors, what they do, how they manage their stress, coping mechanisms, and all of those types of things are what I think would fall into why diseases happen. I know some diseases are, genetic mutations and whatnot. And some people can carry those mutations in their genes and pass them on. But I think a lot of the behavioral decisions that people make represent what can and cannot happen. I do know plenty of people that, of course, live a very healthy lifestyle and they still end up with diseases. But for the most part, not everybody is or has the overload of racial stresses that some groups do, but everybody has a behavioral decision and choices that they make that can affect their health outcomes. And that's the reason why I chose this one over the other ones. Although the other ones do have a lot of key points in them, and I agree with, like the social economical status model, and the fact that your money will determine what kind of gyms you can go to, what kind of doctors you can get for coping mechanisms, what kind of preventive care you can get, support and stuff like that. I think the main thing is your health behavior model, and what choices you decide. Because even money, I've lived in poverty a lot of my life, and money doesn't determine your happiness or what behaviors you make. And that's why I think that. So thank you guys for listening, and I look forward to reading other people's point of views.